Let's talk about hepatitis E vaccine. So, hepatitis E vaccines have been developed. That is because it has been shown that antibodies to the protein that is present on the virus surface, the viral capsid protein, can prevent against infection. So if you take animals, you infect them once with hepatitis E virus, and if you take their plasma, put it into a naive animal, monkey, and then try to infect them with hepatitis C, you cannot cause infection. That shows that the first infection leads to production of something that is circulating in the blood, and it is not cells because we are taking plasma, and that when given into an animal protects against infection. So that means there should be a possibility of making a vaccine. So people have made parts of the viral capsid protein and try to use them for as vaccine. Just like we have made parts, so you're familiar with something called Corbevax. You are so what do we have there? A protein which has been made as a recombinant protein. You give 2 or 3 doses and the person develop antibodies and they protect. So such a vaccine has been developed against hepatitis E virus. It's called as a HEV239 on the technical side. It's also available in some parts of the world, as I'll talk later. It's called Hicolin, and this is effective in preventing symptomatic acute hepatitis. This vaccine has been developed by a Chinese university in association with a Chinese company, and the phase 3 trial, a large trial that was done about, so this vaccine was tested in this large study. The eligibility criteria for people enrolled in this study were they had to be adults, 16 to 65 years of age. They could be either male or female, and they took people, they did not test whether they have antibodies to them or not, hepatitis C or not, and they took everybody. This trial was done in China. It was a double-blind randomized trial, means people were either received a vaccine or received a placebo, and this was a field trial which was done in the community, not in the hospital. So what they did was they took nearly 122,000 people. Some people were excluded because they were pregnant, because they had some other illness. 112,000 with an average age of about 45 years, nearly 45% male, 55% female, and nearly half of them had antibodies. Everybody was not tested, a subsection segment was tested, and nearly half had antibodies. They were randomized to receive, half of them receiving 30 microgram of a recombinant hepatitis E virus protein, and the other 56,000 receiving a placebo, which was nothing but a hepatitis B vaccine, and 3 doses were given intramuscularly at 0, 1, and 6 months. Very good trial, because nearly 86% completed the trial, received all 3 doses, and completed a 19-month follow-up. There were some people, about less than 10% each, who received 1 dose or 2 doses and did not receive 3 doses. They also looked at antibody production in nearly 10% of them, and this is what they found. When they followed these people after vaccination for a period of 19 months, 19 months come from 0, 1, and 6 months are the 3 doses. 1 month after the 3rd dose is when you really expect the effect to become fully, and then 1 year follow-up. And the blue line shows the number of cases of acute hepatitis E in those who received placebo, and the red line in those who received the vaccine. And we can see, if we see, a very good trial. So of the 54,000, nearly everybody continued in the trial for follow-up, and there were 21 cases in the placebo group and only 1 case in the vaccine group, showing that there was 95% protection against hepatitis E with this vaccine. So this is just to show you that a very good trial. Nearly everybody was followed up. Even if they did not receive the second and third dose, they were still followed up. And this is the number. Now, if you look at those who took all, that was everybody, whether they took 3 doses, 2 doses, or 1 dose. This is per protocol for people who received all 3 doses and had complete follow-up. We can see 15 people in the placebo group had hepatitis E, and none in those who had received vaccine, 100% protection. An important thing is that among those who had hepatitis in the placebo group, when they tested viral genotype, they found most of them had genotype 4. So the vaccine is made from the genotype 1 virus, but what it protected against, because we can assume that those who were vaccinated would also then have had genotype 4 disease. So what it prevented against was genotype 4 disease. After this initial report, they have followed up people even further. So this is when they had the original data. They have followed people for another 3 years, and those data have also been published. And we can see, so this was the data for the initial 19 months, and you add another 3 years, we have 55 months data, and we can see the number of cases in the placebo group is 53, that in the vaccine group is 7. So from 21 and 1, we are up to 53 and 7. Again, a very high degree of protection, nearly 85% protection at the end of 4.5 years. Longer term data have not yet been published. Also, when they followed these people over time, they tried to look at what happened to antibody titers, like we have done in the case of COVID. So this is a group of people who were seronegative when they were given the vaccine. On this side, on the right side, we have results for people who were seropositive when they received the vaccine. The red line shows people who received 3 doses. This blue line shows those who received 2 doses, that is dose 1 and dose 3. The purple line shows people who received the first 2 doses, did not get the third. And this green line shows people who received only 1 dose. And this bright blue line shows people who were on the placebo group. So we see antibody titers were the highest at the end of 7 months, that is 1 month after the third dose, and thereafter they have declined over time. And we have seen in the previous slide, some cases have occurred among those who received vaccine as time passed. But in those who were seropositive, those who previously had antibodies, the vaccine pushed up the antibody titers, and irrespective of whether they had got only 1 dose, 2 doses, or 3 doses, the antibody titers have continued to be high. So this is like we know for COVID, those who have already had COVID infection, if you give them vaccine, the combined immunity is, hybrid immunity is possibly better. So that is the kind of thing. But no, we don't have further data, and we'll obviously look forward to getting further data. So what is the status of this vaccine? These papers, as you see, are fairly old. This 4.5-year experience was published as far back as 2015. So this vaccine has been marketed in China. It's marketed by a company called Innovax, the one that developed it. It's called by the name Hicolin. There it was licensed in 2011. However, rest of the world it's not available. Only in China it became available. In Pakistan it became available in 2021. It's not yet available in India. It contains a purified hepatitis E virus protein, 30 microgram per dose. It contains some buffers and thiomersal as a preservative. It comes as a single dose syringe, 0.5 ml. You inject it intramuscular. It has to be stored in refrigerator. It has a shelf life of about 3 years and is to be given as 3 doses. This slide, the cost that I have told you, is the cost that was there in 2015-16. And after that, we really don't know what is the cost. This is the cost that was mentioned in a meeting where, as a part of a WHO committee, I was a part of that committee that looked at this vaccine. So this vaccine has been developed against genotype 1, but we've seen in the Chinese trial it protected against genotype 4. We don't know whether it protects against genotype 2 and 3, but possibly it does. At least in vitro data, if you take a cell culture and try to see, it protects against all genotypes. Does it provide complete sterilizing immunity, that if you take the vaccine, you'll never have disease? The answer is no. Already we can see in the 4.5-year data that the antibody titers come down and some people do get infection. And it is also possible that the immunity will depend on how much virus do you ingest. If you get a small amount of viral exposure, it may not cause, it may protect fully, but if you get a large amount of virus, then that will not be protected. In China, it is approved for use in everybody age 16 and above. It is recommended for people who have a high risk of HIV infection, and this is what the package insert means. But the use in China has been very limited. It has not been used much. Who could we use it for? We could give it to everybody in HIV endemic regions like we gave the COVID vaccine, or we could use it for high risk groups such as pregnant women who live in endemic areas. We could give it to people with chronic liver disease who are at a higher risk of serious disease if they get infection, or immunosuppressed persons. It could also be used for controlling an outbreak and given to travelers. Now, use as a general population vaccine, I don't see that happening in my lifetime, whatever you assume my lifetime to be, because we don't know, how much is the burden and whether that justifies. We don't know the duration of protection. What if it protects only for 5 or 7 years? Are we going to give boosters repeatedly to people? Whether it protects. So protection, what it showed was in China, where the amount of circulating virus in water and community is very small. Whether it will protect to the same degree in India, where we possibly have more contamination of water, we don't know. It appears to protect against disease, but does it protect against subclinical infection and viral excretion by humans? We don't know. When do you give the vaccine? The disease is mainly in adults. At what age do you give it? If you give it at 18, do you give a booster every 5 years? We don't know how long the protection will last, and it's going to be, it's costly, and we don't have it available, so the question is moot. For severe disease in pregnancy. Now the question is, there are very little data for giving this vaccine during pregnancy. We don't know. What was prevented with the vaccine was the usual acute hepatitis. Will the vaccine given protect pregnant women against hepatitis C, the severe form? We don't know. We don't know the duration of protection. So if you give it during one pregnancy, do you give it again in the next pregnancy, or will that carry over? We don't know. There is generally a fear of giving anything during pregnancy. So when do you give it? Early pregnancy, mid pregnancy? We don't know. Or should you give it when women get married, or when we think that they are planning a pregnancy? Again, very difficult to determine. Should we give it to persons with cirrhosis? The problem is it produces antibodies in healthy people. If you give it to people with cirrhosis, will it even induce antibodies, leave aside protection? And that's something that we don't know. And again, we don't know the duration of protection, whether we'll need to give boosters. Same is the problem. This is hepatitis E is seen as a serious disease among immunosuppressed people, organ transplant recipients in the West. Again, they are immunosuppressed. If you give vaccine, they don't mount a good response. We don't know. Can we use it for controlling an outbreak? It becomes very difficult when you have to give 3 doses over 6 months. By that time, the outbreak is already getting controlled by itself. So, however, people have tried something very recently. This is late 2022, that in South Sudan, in a displaced persons camp. So this looks like this. It's a flooded area, and this is a camp that the army maintains of displaced people, about 100,000 people living in unclean surroundings. Sorry. Okay. So MSF has launched a campaign because there was an outbreak of hepatitis E in that area. We really don't know whether it protected, but yes, this has been tried. So it was given to people who were 16 to 40 years of age, because most of the cases were in that age group. Pregnant women were told that we don't have much data on giving this during pregnancy, because the vaccine, the slide that I didn't show you in the previous talk, there were about 50 pregnant women in the trial in China who received hepatitis E vaccine inadvertently, and in them no adverse effects were seen, but that number is too small for us to be able to conclude much. In addition, newer vaccines are being developed. another Chinese lab has developed a vaccine which is not 239 amino acid, but a smaller protein, 179 amino acids. In animals, it has shown to be useful. In humans, a safety trial, a phase 1 trial has been done. It was found to be safe. Efficacy trials have not been done. And yes, in India, a company, Zydus, has developed a vaccine which is nearly identical to the Chinese vaccine. It's been shown to elicit a strong immune response in animal studies. They have done phase 1 trial in about 23 healthy adults, single dose. It induced antibodies, it was safe. Currently, a multicentric phase 2 clinical trial is in progress. Dr. Amit is one of those centers that is doing this trial in healthy people. And there are other centers in Calcutta, IPGMER, and at JIPMER in Pondicherry. So we are trying to work on this. Not only is this a clinical trial, but piggybacking on that, we are also trying to study cellular immune responses. So to summarize, friends, there is a safe and effective subunit vaccine which protects for around 5 years. It's currently approved in only 2 countries and is not available elsewhere. It's possibly, it should be used, but there are some small questions that remain and they need to be addressed, in particular related to disease burden, cost effectiveness, and whether it will protect those special groups that we want to protect against hepatitis E, the immune suppressed persons, the chronic liver disease people, and pregnant women. So we still need to work out. Things will become easier as newer vaccines come in, and I'll talk to you about another smaller protein that a company in China is trying to develop, and also an indigenous effort in the country. Thank you.